Well, good afternoon and welcome to our Lunch Chats, Keeping You Healthy web series. My name is Krista Deans and I manage public relations here at San Ramon Regional Medical Center. For today's presentation, we have the pleasure of introducing Melanie Howard. She's a registered nurse in our family birthing center. And she's going to talk about preparing for childbirth during COVID. And of course, this is an ever-changing situation, but she has some great information on where things stand now. So thank you so much for joining us today, Melanie.
Thank you, Krista, and thank you, San Ramon Regional Medical Center, for inviting me to speak today. I appreciate the opportunity to share information regarding pregnancy during COVID, and I hope that I can enlighten some of you on some really great information. I'd like to share a little bit about myself. 37-year career in maternal child nursing, been in management 10 years, I've taught at the college level. But I'm back to doing what I absolutely love best, and that is bedside nursing. I've been at San Ramon Regional for 17 years, and I love it. It's a great place to work. And I feel blessed. How many people can say, every day I go to work, I get to witness the miracle of life. So it's very awesome. So thank you for having me today. I'd like to tell you a little bit about what I'm going to talk about today. First of all, I'll review some research-based findings over the past 15 months and the recommendation that is for pregnant women regarding COVID and vaccinations. I'll also touch base on pregnancy during COVID and what you can expect, you and your partner, when you come into the hospital. And lastly, I'd like to share a little bit about my prepared childbirth class and why I think it's important to get educated before the big day. So in preparation for today, I read a number of journal articles, a couple of online courses, and I just like to say that I am not the expert, but I am very happy that I have this information to share. And I pulled mainly from a webinar that I attended in June. It was A1's town hall meeting, COVID-19 vaccine and reproductive health. It was excellent. It's a 1-hour webinar that was presented by Karen Crowley. She's VP of Nursing, Education, Research, and Practice for A1. A1, Association of Women's Health, Obstetrical and Neonatal Nursing, is a professional organization. And again, I can't stress how valuable I thought this webinar was. So what was concluded from the last 15 months of research is that absolutely pregnant women are more likely to be infected with COVID than non-pregnant women. And they're also more likely to experience more serious illnesses, including hospitalizations, ICU admissions for breathing assistance, and even possible death compared to non-pregnant women. So it's important. Vaccination is very important. Also, what was shown is that pregnant women with a history of COVID or have had current infection are at increased risk for preterm labor, having the baby a little too early, hypertension or high blood pressure, and then preeclampsia and eclampsia. And those are technical terms, but they do refer to a complication that can be experienced with pregnancy. And I'll come back to that in just a little bit. In addition, COVID positive current infections or history of COVID, those babies end up in the neonatal intensive care unit, the NICU, some of them. Approximately 13% of babies born to positive COVID moms test positive at delivery. And that is known that delivery by C-section also increases that risk. So all these organizations, ACOG, which is American College of Obstetrical Care, guides the practice for OBs. A1, I shared what that stands for, American Academy of Breastfeeding, Centers of Disease Control. I could keep going on, but all these professional organizations, and in fact, there are in total 23 nursing organizations with 750,000 individuals who have collaborated their efforts in distributing and sharing information to patients and communities. And they all have one specific recommendation, and that is that all pregnant women should be vaccinated. Lactating, breastfeeding moms, please be vaccinated. And also it's recommended that for women considering pregnancy in the future, that they also get vaccinated. And part of getting prepared for today, I also talked to a number of the OBs I work with, and I told them that I was presenting today. And I asked them if I could share one thing, one piece of information or recommendation. And they all, without hesitation, said, please, please tell all pregnant women that they need to be vaccinated. That cannot be stressed enough. So your doctors want you to be vaccinated. All the research shows that you should be vaccinated. And all that I could find, the only contraindication for vaccination, the one exception is if you had a reaction, if you are taking the 2-dose, either Pfizer or Moderna, and you have a reaction, then it's not recommended for the second vaccine. I just want to share that at the end of the webinar, Karen did say that the information that I've just shared with you and her webinar in general is open for public view and for anyone to be patients or communities. She's happy to get the information out. So I will forward on that webinar to Krista, and it'll be available for you if you're interested later. So once vaccinated, you are protected. That's exciting, exciting news. And I'm sure you have heard Moderna, the efficacy, it's effective in helping prevent COVID, 94%, and that's the 2 injections 4 weeks apart. Pfizer, 95% effective, and that's 2 shots 3 weeks apart. And Johnson & Johnson is the 1 shot with 72% effectiveness. So the takeaway here, though, everyone, is the vaccines are great, but you are not 100% covered. However, research has shown that if you do get COVID after being vaccinated, your risks are significantly reduced for serious infection for yourself, hospitalizations, or death. And once you're vaccinated, you are helping to protect your baby. And that's so very important. Just to share, immunoglobulin or IgG is the main type of antibody found in our bodies that help protect us from viruses and infections. And the research has shown that the antibodies are transferred through the placenta and through the cord blood. And so it's perfect in helping to protect your baby. And it is shown with breastfeeding, it passes through breast milk. So again, you're protecting your baby. The research showed that if you have after the first vaccination, those antibodies are transferred through the placenta and cord blood and increased by 44%. And once you're fully vaccinated, the research shows that the antibodies transfer 99%. So very important information. So I have great news. The goal being that once we as a nation attain 70%, we know that that's an important percentage and that it will help to prevent the spread of the COVID virus. And California, I'm very happy to share, this is from East Bay Times and dated June 23rd. And it's showing that the state of California has reached 70%. Very good news. And just to let you know, a lot of counties here in the Bay Area have improved even beyond that. I'll just mention Alameda is at 79%, Marin 87.6, Santa Clara 83, San Mateo 82, San Francisco 81. So the Bay Area is doing a great job, and that's great news for us and our community. If you have not been vaccinated and you're interested at a no cost offer to you, please, you can schedule that at www.myturn.ca.gov. Again, www.myturn.ca.gov. So that is what I wanted to share about what I learned about COVID and pregnancy. And now I'd like to talk to you a little bit about what you can expect when you come to the hospital, when you and your support person come. First of all, I apologize I didn't include it on the slide, but I wanted to let you know that in gathering this information, I did call all local hospitals, about 4 or 5 of them near here, and we're all about on the same page. There may be a little bit of differences, but it makes sense that we're all doing the same thing, as hospitals are going by CDC recommendations and county and state recommendations as well. So just so that you know, when you come in, so say you think you're in labor, or maybe you think your bag of water broke. When you come in and get triaged, when we're evaluating whether or not, yes, you in fact need to be admitted, or maybe not, maybe you go home, you need to come in to the hospital by yourself. That is the one time your support person can't join you. And that's for about an hour or so. But I just wanted to make sure you were aware of that. Once it is determined that you're going to be admitted, then absolutely your support person, your partner will come in. Um, and I just again wanted to make sure. Now, if you're a direct admit, say you're coming in for an induction of labor or a scheduled C-section, yes, both of you come in. Okay, I just wanted to explain that to you. So you're allowed one support person, and fairly recently, a few weeks ago, we changed to you also are allowed one visitor, and that is between the hours of 10 a.m. to 8 p.m. So just so you know, that's good news. And again, all these things I'm reviewing right now, information is changing, it's fluid, it could change again, and hopefully some of the restrictions will be lifted in time. That would be really nice. Once you are admitted, both you and your partner will be tested for COVID. We use the rapid test just to check on the status and see that everyone's okay. And I wanted to give you a clue into the idea that when you deliver, not only will your primary nurse be with you, of course, your OB will be there to deliver the baby. The pediatrician attends the delivery with a NICU nurse, and typically the charge nurse comes in too as a resource. So we all come in, we'll have face masks, face shields, your OB gowned and gloved, and so we're suited up is how I put it. And I just wanted you to be aware of that and know that that will happen. The nourishment room is accessible only by staff at this time because of COVID. We do have a number of snacks, half sandwich, yogurt, juices, crackers, different variety. But by all means, bring your own snacks, okay? Whatever you and your partner would enjoy. And the meals, we used to provide meals for the partner, and that was a while back when the expectation was that your partner comes in and is with you in the room 24/7. They were not allowed to come and go. So that has changed. And now that your partner can come and go for meals, we only provide mom with the meal at this time. Uh, I we do ask that if your partner does leave, they just simply go home and back. In other words, maybe they need to go let out the dog or take a shower. But we ask that once you're admitted and they've been COVID tested, that we don't want them out in the community. We don't want them going to the grocery store or just out and about. Okay. And then the one support person that you're allowed, the visitor, just so you know, that is one designated individual. So you can't tag team it. You can't have five different people taking their turn. So just wanted you to know that. The most important thing, though, that I want to say is, and all hospitals want you to wear your mask at all times. At least at San Ramon, we feel very strongly about that, is to protect you and to protect everyone else. And so back March, April of 2020, when COVID started and nurses were required, everyone in the hospital had to wear a mask. And I had to wear it for my 12-hour shift. It was hard. It was difficult to get accustomed to that. Now during my 12-hour shift, I'm not even aware. I just the mask is just it feels very comfortable, very normal. So my biggest recommendation to you is to start getting comfortable wearing the mask long term, meaning you probably wear it. Yes, you wear it to go to your doctor's appointments or run an errand, but you're going to be wearing it at the hospital. And the expectation is at San Ramon that you wear it all the time unless you're actively eating or drinking. So maybe tonight, watching the Netflix movie, you wear it for a couple of hours, and by next week you're wearing it 4 hours. But get very, very comfortable with that. I feel that the more this is not an issue, wearing a mask, it makes for a more positive experience when you come into the hospital to have your baby. So get comfortable wearing your mask. And I'd like to just end here, talk to you a little bit about my childbirth class that I offer. I think that first time parents especially absolutely need to get educated, and I'm talking about my class, and I'm hoping many people are interested in it. But if you don't take my class, please get educated somewhere out in the community or on your own. I like to use an analogy that when you got your driver's license, I'm sure you went down to DMV and you got the little booklet, or went online and you read the information probably more than once. And the reason was is you wanted to do well. You wanted to pass the test. You were wanting to be prepared. And I think birthing a baby is even maybe a little bit more important than a driver's license. So please get all the knowledge you can. It will help you. And I feel like by getting prepared, it makes you more confident and comfortable for the experience you're about to have. So just to share, my class is a long one day, a little bit long, from like 9 to about 3, 4 o'clock. Usually doesn't go quite that late, but I cover everything, and the reason it is one day is I do an evaluation at the end of my class, and basically people want to get in, get out, be done. I used to teach it 4 different Tuesday evenings, and now it's just one day, and I think people really like that better. So my class, I talk about pregnancy topics, labor pain, pain theories, signs of pre-labor. I explain to you when you should call your doctor, what signs and symptoms to look out for. And that's when I go into a little bit more detail about that preeclampsia and eclampsia and other things that you need to know. I review onset and stages of labor, so early labor, active labor, transition, and then pushing. And just so you know, throughout the day, it's just, I'm not just talking, but you see a lot of videos. I have some great videos. I review comfort measures for what things that will help you with your laboring, packing your bag, what you should bring to the hospital, what you shouldn't. I help with tips for your partner, how they can help better to assist you during your laboring experience, tips for you if you have a long labor. I review birth plans, explain to you when you should go to the hospital, and how to prepare for your hospital stay in general. Again, birth, we see some videos, you get to see babies get born. I talk about medical interventions during labor, pain relief medications. We do talk about C-sections. I have a video on that, but I promise it's not scary. It's animated. So you'll enjoy that. But of all the things that I talk about that day, I think the next part is probably the most important, and that is postpartum physical and lifestyle changes. Having a baby is wonderful, but there is definitely a transitioning time for when you bring the baby home, and how best do you handle that transition time. I give a lot of advice on that. And then at the end, we do breathing and relaxation exercises that will help you when you're having those contractions. And some of you may be thinking, I'm getting that epidural and that's what I want. So I don't really need all that breathing and relaxation, but you do. You can't come in and be 1 centimeter and smiling and be able to get that epidural. You will have to labor some. And so you absolutely need breathing and relaxation. So I review all of these things just to let you know it's not all business. We have a good time. We have fun. I have a number of cartoon laugh breaks. I have some fetal fun facts. And again, it's divided in 4 parts. So at the end of each part, there's a good minute worth of real nice pictures, quotations, and music that I think that you will enjoy. So I hope that you check it out if you'd like. And this is the 1-800 number to register, or San Ramon's website, or simply just Google San Ramon Regional Medical Center. And once the web page comes up, it has virtual classes. And just to let you know, it is taught by Zoom. I'm getting great feedback. It's working out just fine. You get all the same information I did the same as when I was in the classroom. So hopefully we'll get back to classroom setting down the road, but right now I am teaching it by Zoom. So if you're interested, I'd love for you to come. And I thank you for this opportunity to share a little information about pregnancy during COVID. I appreciate your time.
Thank you so much, Melanie. It's just wonderful information, and it's, of course, not only timely now, but always. So we really appreciate you taking the time to talk with us today. And if anyone does have any questions for Melanie that maybe we didn't cover today, or you want that presentation that she referenced earlier, just head to our website and go to the Contact Us page, and we'll make sure that we get you in touch with her and make sure that we answer any questions you have. So thanks again, Melanie. We really appreciate it.
Thank you, Krista.
Take care, everyone.